The World Health Organization, abbreviated WHO, defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. Healthcare problems can include any physical malfunction, injury, or disease. It can be anything from a prematurely born infant to a 90-year-old person with clogged arteries. One of the biggest factors in causing health problems is having an unhealthy lifestyle. This can include choices such as lack of exercise, an unhealthy diet, smoking, being overweight, and having high stress levels. Another large factor is actual physical injuries. In 2007, ages 15 to 24, 47% of people died from accidents, 16% from homicide, and 12% from suicide in the United States alone. The third factor is problems within our environment. This includes problems such as air pollution, water pollution, pesticides, nuclear and industrial waste. The fourth contributing factor is poverty. These include issues such as malnutrition, air quality, lack of medicine, unsafe water, and poor sanitation. The fifth contributing factor is the spreading of contagious diseases. The most commonly seen and heard about diseases globally include cholera, typhoid fever, sexually transmitted diseases, and HIV/AIDS.
Social workers play very important roles in the healthcare system. They are commonly referred as medical social workers. Oftentimes, social workers can work in various places such as hospitals, clinics, rehabilitation centers, nursing homes, health departments, hospices, and home health agencies. Social workers help clients at all levels. These levels include preventative care, primary care, which is the ongoing care of patients before they are diagnosed with a disease, secondary care, which is for patients being treated for their illness, tertiary care, which is for patients being treated for life-threatening illnesses, restorative care, which is during the patient's time of recovery from an illness and continuing care. A social worker can play many other important roles in the healthcare field. They can help patients to understand confusing medical jargon so that they understand exactly what is going on. They can provide emotional support in regards to helping patients with terminal illnesses. They help the client deal with their feelings and often assist in making end-of-life plans. Social workers can aid in helping clients make lifestyle adjustments due to an illness. They can also be of help to parents whose child has been diagnosed with an illness and act as a broker to link their clients to necessary resources and services. They also assist in helping to make financial arrangements for medical bills. Social workers also play an important role in educating their clients about health lifestyle choices and how to prevent illnesses from occurring. The largest employer of MSWs is in the U.S. Department of Veteran Affairs. These social workers are there to help to veterans ease their way back into society by giving them counseling as well as help with finding employment. They also are there to assist the veterans' families as well. Social workers are very important when it comes to crisis intervention and therapeutic intervention. A common example would be a person suffering from post-traumatic stress disorder.
There are three major problems within the macro environment of the healthcare system. The first problem being the rapidly growing cost of healthcare. U.S. healthcare costs are more expensive per capita than in any other nation in the world. The reason as to why healthcare costs are constantly increasing include the fact that there are new technological advances being made every day, and with new advances bring new costs. Another issue is that since life expectancy is increasing, people are needing to be taken care of for longer. Administrative costs for the healthcare system in the U.S. are 6 times higher than in any other Western European country. And lastly, one of the biggest problems is the price of prescription drugs skyrocketing and the cost of public and private health care continuously rising. The second major problem in the healthcare system is unequal access to adequate health care. 15.2% of the United States doesn't have health insurance. That's over 46.3 million people. Congress passed the Patient Protection and Affordable Care Act in 2010. This act was trying to improve the amount of people with health insurance by doing things such as lowering healthcare costs, plans to reduce the inequalities in the healthcare system as well. The third major issue is problems in managed care and ethical issues. Managed care is a healthcare system under which the insurer controls the person's healthcare, and healthcare providers agree to accept a set fee per treatment or a flat rate per patient. Basically, it's a system where patients agree to visit only certain doctors and hospitals, and in which the cost of treatment is monitored by managing companies. The company has a contract with medical facilities to provide care at a reduced cost. Ethical issues with this type of care include whether giving them restrictions on where they can go and reducing the cost is really giving the patient the best care they can and should be getting. Is cutting corners and saving your money really the best when it comes to your health? Social workers must go to advocate for their clients in order to get them the care that they deserve while also making the deal fair on the company's part. The U.S. healthcare system needs to be aware of the nation's various racial, ethnic, and cultural groups. Social workers have an ethical responsibility to examine, attend to, and advocate for positive change concerning these groups' health and welfare. Healthcare systems need to be respectful of a client's cultural values and belief systems, which may become a major barrier in providing effective services.
In Africa alone, there are nearly 22.5 million sufferers of HIV. In 2009, roughly 1.8 million people died from AIDS-related conditions globally. In China, AIDS is becoming an epidemic across the entire country. Major spreaders of the disease include drug smugglers, truck drivers, and prostitutes. In 2009, globally, there are 33.3 million HIV sufferers, and that number continues to increase. And 11 statistics show that 1.1 million HIV sufferers live in the U.S. Of those 1.1 million, 50% of them are African American, and 19.6% were of Hispanic descent. AIDS stands for Acquired Immune Deficiency Syndrome, which is caused by a human immunodeficiency virus. HIV is a disease that destroys the body's immune system. Even a common illness can be life-threatening to a person with HIV. It attacks the white blood cells that help fight off diseases invading the body. There is no known cure for HIV or AIDS. Due to the HIV/AIDS epidemic in Africa, life expectancy has dropped to 52. Social workers help people living with AIDS by making them feel good about themselves and letting them know that they are still in control of their lives. They teach that their illness is not what controls them. Provide counseling at the beginning stages and later on when a patient might feel depressed or hopeless. What can be done to help Africa? Provide serious educational programs about HIV/AIDS. Publicize the potential consequences of casual, unprotected sex. Empower women to have greater control over their own sex lives. Lower the cost of medicine.
From completing this presentation, we have learned social workers help not only clients in the U.S., but all over the world. Social workers play an important role in providing education and resources about HIV/AIDS in their effort to try and stop the spreading about the disease. Social workers are able to help make plans for lifestyle changes due to changing health conditions. Social workers help not only their client, but families as well. Programs have been put in place to help aid in the lowering of healthcare costs.